they gave between the recommended dose and also the actual intake. And these you can see that the lutein plus ZIA are the uh, dominant carotenoids in the older generation and also in infant brain. So oxidative stress and the inflammation contribute to age-related cognitive decline, mild cognitive impairment, and also Alzheimer's disease. And why is that? And why both eye and brain are sensitive to oxidation and inflammation? That's because, for example, in the brain, the polyunsaturated fatty acid has a very high content in the brain, and also the metabolic activity in the brain is also high, and the oxygen demand is high, and relative low content of antioxidants in the brain. And scientists also find out that risk factors of age-related cognitive decline are very similar to age-related macular degeneration. For example, it both affected by genetics, age and gender, diet and obesity, and also tobacco use. And the study shows that eating vegetable is related to better brain health. So the healthy subject with higher fruit and vegetable intake, which is 5 daily portions, have higher blood antioxidant levels and better cognition scores compared with those who only take 1 portion daily. And interestingly, dietary intakes of lutein and ZIA were found to be significantly lower in Alzheimer's disease compared to healthy controls who is not eating much. And how lutein can help to protect the brain. So lutein is deposited especially in the most vulnerable region of the membrane and rich in PUFA. So lutein can help to decrease the oxidative stress, decrease the inflammation, and also act as an antioxidant moleculars in red blood cells. And it can decrease the level of membrane phospholipid hydroperoxides. And the red blood cell, if red blood cell with high phospholipid hyperperoxide, it can decrease the ability to transport oxygen to the brain, which may contribute to Alzheimer's disease. Additionally, lutein can help to inhibit amyloid beta oligomer and also fiber formation, and it can also integrate into the cellular membrane and influence their functional properties and also structure stability. And it can also enhance the gate junction for communication, which is also very important for visual system. And we know that for eye health, at least 10 milligram of lutein, 2 milligram of ZIA per day. But how about brain? Now there are already more than 10 publications for human intervention studies using lutein for brain health. Some conclusions for the first section. The eye is an extension of the brain. Lutein is found in human eye and also brain. Lutein is selectively taken up into the infant and also human brain. And increase the level of lutein in the serum and also eye are related to better cognitive in healthy adults. Increasing the level of MPOD, which is macular pigment optical density, it means the lutein plus ZIA concentration in the eye are related to better cognition in children. And intervention studies shows that supplementation with lutein improves cognitive function. So let's dive into the science. And now there are already more than 15 animal publications, more than 40 ethnological publications, and also more than 70 interventional publications about lutein and brain health. For animal studies, some interesting finding, lutein was also found to be the dominant brain carotenoid in primates. And if we gave the infant primates lutein, and it was found to increase the retinal and also brain lutein as well. And then lutein and zeaxanthin concentration in the eye were related to the lutein and zeaxanthin concentration in the brain. For the children study, uh, the study finds that higher carotenoid status has been linked to improved cognitive functioning for pre-adolescent children, and also lutein together with choline, it's shown to work together to support the infant brain development. And also in many studies also shows that lutein and zea can help to improve the cognitive performance, memory, and also academic achievement. So after I saw the study, I immediately forced my son to take lutein every day. But it seems like his gaming skill improves a lot, but not academic achievement. Okay, and the next part is for MPOD. For MPOD is related, so MPOD is a concentration of lutein and zea in the eye. MPOD is related to processing and also perceptual speed and reaction time. And also, MPOD is also related to prospective memory, executive function, mental processing speed, and also sustained attention. Additionally, higher plasma lutein has been found to significantly associate with the decreased risk of dementia, and lower serum lutein levels were also found in subjects with MCI, Alzheimer's disease, vascular dementia, compared with the healthy control subjects. And many studies also show that lutein and zea were associated with verbal learning and also memory. And let's take a closer look into the intervention studies. The first study was conducted in 2008. It was to assess the effect of supplementation of 12 mg of lutein plus 800 mg of DHA